Hello, I welcome you all in today's session. We are celebrating Women's Day this year by spreading awareness about cancer detection and care. The theme of this program is Yes, I can detect cancer early. Yes, I can survive cancer. In this series of events, we are talking various field experts about early cancer detection and care for women. Cancer is a disease that has potential to debilitate the life of a person physically, emotionally, and economically in a manner other ailments can. Women are custodians of our family health, playing a critical role in maintaining the health and well-being of our communities. In other words, healthy women will ensure healthy families, healthy communities, and a healthy nation. Hello, I welcome you all in today's session. We are talking to Dr. Amrit Kaur Kaler, who is consultant molecular pathology at Kokilaben Dhirubhai Ambani Hospital and Research Institute, Mumbai. Welcome to today's session, Dr. Kaler.
Good evening, Ashutosh. Thank you so much. Thank you so much.
Dr. Kaler, one of the important things that comes first being a lady, that why should I get tested for cancer? Or am I the one who needs testing? So according to you, Dr. Kaler, who should be going for cancer screening, and what is the age when a woman should decide to do any cancer screening?
See, Ashutosh, there are different guideline protocols for the women with heritable and non-heritable cancers. And I will first talk about the heritable cancers. Any lady who has a family history of cancer, either her mother or an aunt or a sister who carries a particular gene, it is very important to screen yourself for that particular gene if you have a family history. And recognizing that particular gene is significant, as you can, predict the cancer type and also the type of cancer which can happen in the later years of life. So I recommend that if you have a family history, go for a cancer screening at an early age of life. Suppose now for the breast cancer, if you carry a gene for BRCA1 and BRCA2 gene, identifying your syndrome helps you for a proper screening programs, and that helps you to prevent cancer. And similar things happen with the colorectal malignancies, which are also very significant in women age. Like we have a HPNCC syndrome, or the Lynch syndrome, in which the endometrial and the colorectal cancers are common. So it's very important to start at an early age if you have a heritable history of cancers. And the germline syndromes are increasingly becoming very common, especially in the breast. We have a triple negative breast cancer, and they are being associated with this HBOC syndrome or the hereditary breast and ovarian cancer. So, but for the normal women who does not have a family history, I'm sure they have proper guidelines set by the government, which says that you should do a self-examination for the breast starting after 30 years, and you should get mammography done after 40 years, after every 5 years, and that helps a proper screen for the breast cancer. And for the cervical cancer, I think the pap smear should start at the age of 21 years, and it can go to 65 years with or without HPV testings. So similarly, we have some protocols for colorectal malignancies and oral cancers, which are quite common.
Okay, so Dr. Kaler, we have so many different types of cancers. As far as Indian population is concerned, what are the common cancers types in Indian population?
Yes,
especially in respect to women's health.
Yes. Ashutosh, as we know that we have different cancers for both men and women, and for this International Women's Day, we will try to specify on the cancers which are more common in women. The number one disease, which is very, very common in women, is a breast cancer, which constitutes about 27% of the total cancers. Okay. Now followed by cervical cancer, followed by oral cavity, then we have colorectal malignancies. Now, surprisingly, the death rate occurring from the breast cancer, it is about 16 to 17%, which is about 50% of the total cancers which are being picked up, at an early or a late stage. So now this makes it very mandatory for us to get yourself screened properly at an early age, so that it can be picked up at an early age and it can be treated. Okay. So we all know that prevention is better than cure. Okay. So I'm saying the cervical cancer has decreased quite a bit, but the breast cancer is coming up.
Okay. And if you talk about the treatment options, so what are the various treatment options available?
Yeah. So among the treatments we have, in addition to the chemotherapy and the radiotherapy, nowadays we have a very good treatments known as targeted treatments which are available, in which we can identify the risk based on the genes which are mutated. And Ashutosh, it's very we can say congratulating that the science has grown so much that those genes can be targeted and the tumor can be erased from the body. And in addition, we have our body's own immune cells fighting against the cancer. So we give them immunotherapy, which helps the body to heal much more faster. So cancer is no more a stigma in this modern world. It is treatable. So I suggest all my fellow women to just move out, come out with their disease, get yourself screened. And if you by chance get a lump in your breast or in some abnormality on your pap smear, please come forward and there are treatments available and you can be treated.
Okay, so thanks for giving us such an insightful information. So one last question for today's, keeping upcoming Women's Day in mind. So what will be your message to women who are listening to us through this program? How should they be taking care of themselves, especially in cancer care?
Yeah, Ashutosh, thank you so much. I feel as a woman, I feel so much, obliged to help women around me, and I give them so much of tips. And first of all, I feel that all the women in India should get themselves screened. There is a little bit of lagging behind in the initiative which women feel nowadays, that that they feel that they cannot talk to people around about their problems. But I feel that they should break this wall around them, and it's their health, it's their life, it's their slogan that they want to get treated, they want to be in a better place. So the world can be better only if the women are helped and if the women are healthy in the society. So I suggest all the women to come forward, start the screening at the appropriate time, at the appropriate place with the appropriate treatment, so that they can take care of their families and move ahead. So I wish you all the best on this International Women's Day, and I am very much honored to be on as a part of this message. And thank you so much, Ashutosh, for giving me this opportunity to talk on this particular topic. Thank you.
Thank you, Dr. Kaler, for being part of this program. Thank you very much.